nilang personal posting na talaga pong naramdaman nila yung tulong po ng PhilHealth noong nakaraang taon. Kaya po sa mga provider naman, ang hinahikayat ko, handa na po ang sistema, sapat na po ang pondo, mas malaki na po ang coverage, mas mabilis ang bayad, pero kailangan po natin ng pakikiisa. Kasama na po dyan yung mga doktor natin at ating mga hospital. Magtulungan po tayo. Yun lang po. Thank you very much.
Para po sa unang katanungan, Kat Domingo, ABS-CBN.
Good morning, Secretary. Sir, Hi, sir. For Secretary Herbosa, sir, how does the Department of Health respond to the COA's findings that 405 million pesos worth of medical equipment were remained idle or unutilized due to the absence of a well-structured plan, lack of site readiness, delayed procurement actions, and inadequate coordination and monitoring? That's according to the COA, sir.
This is a COA report of December 31, 2024. So released in 2025. So you have to understand there was a whole year of 2025 to fulfill the implementation of all those programs. So I still have to check if it's still 405 million that has not been installed. I will bet na-install na ang karamihan noon. So take into consideration that when you're reporting that, take the date and time that the COA did the observation.
Sir, but the spirit of the question or the point of the COA is that there was allegedly, supposedly, an absence of a well-structured plan, a lack of site readiness. How does the DOH respond to those comments given that it has received one of the biggest allocations under the 2026
I don't understand
budget?
when you say there is lack of a structured plan. In government, before you can even request for the budget, you have to have a detailed province-wide investment plan for health. Merong process yan. So I don't know what the auditor means when he say walang lack of plan. Number two, before it even gets to NEP, binubusisi po yan ng regional director, ng central office ng DOH, ng DBM regional office, ng BM, before it even gets into the budget. So nakaplano po lahat yan. And then eventually, pag na-implement yan, depends who implemented it. Kasi there are many people, hindi lang DOH nag-i-implement po ng ating Health Facilities Enhancement Program. There are 3 agencies that actually implement it. The LGU itself can be the one implementing it. The DPWH can be the one implementing it. The regional office can be the one implementing it. So depending on who is implementing it, there can be some delay. And then there are different contractors. Iba-iba yan. Merong mabagal, merong nag-walk away, merong delay in one part, delay in the construction. Of course, kung na-delay yung construction, hindi mo ma-install yung equipment kasi hindi pa tapos yung facility. So you need to finish the facility or, terminate the contract and get another contractor to finish it. So talagang may problems. Those are actual problems in government governance. Talagang hindi yan masi-zero. That will always happen. And that's why you have officials to run and manage this. So you have to check. So when you report that, my suggestion to you is to look first what has happened to it in the year 2025 because that was a 2024 COA audit observation.
And sir, based on the findings of the DOH, what happened to it? What do you attribute the biggest bottleneck? What is the main culprit for the misdelivered or the misuse or the according to the COA?
So I will tell you, I will give you back, I will get back to you, and I will look at that 405 million that they're claiming, and I will tell you how much of that has already been installed or completed in 2025. Yun ang dapat hinanap nyo.
Sir, yun nga po hinahanap namin sa inyo ngayon, sir. Wala po kayong data with regard to the update on
Well,
this
I'm
one?
here to discuss the budget. If you want, I can go back to you. I will give you a report on the 405.
Sir, last na. But initially, sir, bakit po hindi na-roll out as it is on 2024 itself? Bakit po kailangan pa natin maghintay ng 2025 for it to be rolled out? What do you think is the biggest problem in the system that needs to be addressed immediately?
You're wrong, no? When a budget is released, it has a 2-year cycle. There is what's called continuing appropriations. When it is released, there are many reasons. Sometimes the money is not released to us. Sometimes the money is not available. So the money is released in the latter part of 2024. So sometimes the implementation happens in 2025. So dapat you should understand that that's how it's happened. So it's not a negative thing. It's a good thing. That's why COA monitors whether we complete the money or not. For your information, I returned only about 800 pesos of the 2025 budget. That means we already obligated a lot of the money. In 2024, we returned, I think, 800 million. So malaki yun. So there's a lot of improvement from 2024 to 2025.
Susunod na katanungan, Clay Perdilla, PTV4.
Good morning po, Secretary Herbosa. Sir, nabanggit nyo kanina mag-expand na po sa mga LGUs yung zero balance billing. How many LGUs will benefit from the additional 1 billion allotted for them? At saan po yung mga lugar na priority area? Salamat po.
So that's a good question. We only have 1 billion to support the local government, but local government hospitals are a lot. In fact, mas marami siya kaysa sa DOH hospitals. For the level 1 hospitals, ang feeling namin, kaya na siya i-support nung increased benefits of PhilHealth. So, alam yun ng mga local chief executive. But for hospitals, for LGUs that have level 2 and level 3 hospitals, ito yung mas complex procedures and higher cost of care. Sila yung gagamitin nating pilot. And then we have actually selected provinces that have actually fulfilled their commitments to universal health coverage. And these are yung mga Sarangani, Laguna, Aklan. So, there are about 5 of them. Pa-prioritize ko sila. Number 2, we are also trying to prioritize LGU hospitals that are in provinces that have no DOH hospital para magkaroon ng zero balance billing yung provinces na yun. So, may mga criteria kaming isusulat on how to spend the 1 billion. For the rest of the LGUs, pwede pa rin namin silang tulungan per patient basis through the MAIPIP. So ang mangyayari dito, I will ask my medical center chiefs to have a memorandum of agreement with an LGU hospital, and ipuno yung DOH hospital, papalipatin namin sila sa LGU hospital, pero sasagutin namin zero balance yung pasyente doon. So the fund continues to support our Filipinos na magpapa-basic accommodation.
Sunod, Samuel Medinilla, Business Mirror.
Good morning po. Magfa-follow up lang po kami regarding po dun sa MAIF guidelines na na-announce po kahapon. Kailan po kaya natin expected ma-complete yung guidelines?
So I expect to have the guidelines by the end of the month or by February, mid-February. So meron na kaming basic principles and a working draft. As of now, MAIF will be following the existing 2025 IRR, Implementing Rules and Regulations. So yun muna ang susundin ko until masulat namin yung current for the 2026.
I-clarify ko lang po. So sa ngayon po, until malabas yung guidelines, i-accommodate pa po muna natin yung mga existing referral letters from some politicians po.
Yes, kasi 2025 pa yun eh. That's still a 2025 fund. Hindi pa yung 2026 fund. So yung IRR will be used for the 2026 fund.
May projected na po kaya tayong transition period? Halimbawa malabas na yung IRR kung hanggang kailan po natin i-accommodate yung mga previous letters?
The moment we have the new IRR, it's immediately implementable. There's no transition.
Tapos last na lang, usually po ano yung average na number of referral letters na natatanggap ng DOH for MAIF po?
I don't have that figure. We don't count the referral letters. Basta we have the funds, we actually assist the patients.
Thank you po.
Follow-up question, Dexter Cabal sa Inquirer.
Good morning po, Sec. Mag-ask lang po sana if what brought the change of position ng DOH regarding po sa MAIFIP. Kasi if we remember, parang...
Change in position?
Yes
What
po,
position?
parang sabi po ng DOH...
Position to the previous position?
Position for the sa MAIFIP.
Anong position yun?
Kasi parang by July or early last year, parang gusto po sana ng DOH is parang to do away with the MAIF and
Sino nagsabi niyan?
And the guarantee letters, and ang gawin po ay
To do away with guarantee letters.
Yes, and
But we
directly
really do
fund
not use
PhilHealth.
guarantee letters. The DOH does not use guarantee letters. We only give guarantee letters to private hospitals that we have a MOA with. But other than that, we don't use guarantee letters.
Ba't ang sinabi niyo, ang sabi po ng DOH ay ang gawin po
Sinabi na Nino sa DOH. Ano
think-
yung tanong mo? Anong binago? The MAIP has been there. In 2025, we had the MAIPIP, Medical Assistance for Indigent and Financially Incapacitated. Meron siyang implementing rules and regulations.
Ang gawin po ay parang yung PhilHealth, sa PhilHealth na lang po ibigay yung funds for the
Hindi yata DOH nagsabi niyan. Hindi yata DOH ang sabi dyan. Some other health advocates are the ones pushing for, you see, what happened is, the MAIP, when it started, was called MAIP, Medical Assistance, MAP actually when it started, was because PhilHealth was so low. The support value of PhilHealth. That's the history of the MAIP. So the legislators decided to put the fund in the DOH to help support indigent patients para no balance billing. The old program was called no balance billing. The MAIP was started for no balance billing of indigents. Pas na-expand yan. But today, we're already expanding PhilHealth benefit packages. So there's been no change in position. The two support each other. We are able to do zero balance billing because we have PhilHealth, we have MyPIP, and then we have the MOOE. Yan ang reason na people feel ang zero balance billing. So wala kaming change na position.
Follow-up ka, Kat Domingo.
Sir, same topic. Sir, just to clarify, baka po kasi yung I know you're in the process of drafting the IRR, the new IRR. Pero sir, ang mga normal Filipinos ba, ordinary Filipinos, papayagan pa rin po ba silang kumuha ng guarantee letters from politicians considering that the DOH has already said na hindi naman talaga kailangan yung mga GL?
Excuse me, hindi DOH po ang nagsabi yung mga mambabatas. Sila naglagay sa batas. And I will read the provision sa inyo para malinaw tayo para hindi tayo nagkakalituan. This is what Section 19 says. Prohibition on political involvement in the distribution of cash and other forms of financial assistance. All cash assistance and other forms of financial aid distributions shall be conducted exclusively by the authorized government officers and personnel or accredited partners. No public officials holding elective position, yung binoto, electoral candidates, politicians, political parties, and any of their representatives, except for officials having direct administrative and executive authority over the implementing agency, shall influence, be present in, participate in, or take part in the actual distribution of any cash assistance and other forms of financial aid in the following programs: protective services for individuals and families in difficult circumstances, tulong panghanap buhay sa ating disadvantaged and displaced workers, medical assistance to indigent and financially incapacitated patients program, and other similar government financial assistance programs. No political signage, branding, paraphernalia, or activity shall be displayed or conducted within the distribution area. The national government agencies responsible for distributing cash assistance and other forms of financial aid shall establish, formulate, adopt, and enforce mandatory requirements, protocols, and reporting mechanisms to ensure strict compliance to this policy. The Joint Congressional Oversight Committee on Public Expenditures shall monitor agencies' compliance with the requirements of this general provision. So it is in the law.
Sir,
The law now, we have to follow the law.
Secretary,
Go to the government officials that need it. So if you want medical assistance for financially incapacitated patients, you go to the medical social worker in the hospital, you go to the hospital director, you go to the regional hospital director if you're in an LGU hospital or in a private hospital.
Sir, I think what needs to be clarified kasi yung iba pong mga tao, pumipila sila sa opisina, not at the distribution site, pero dun sa opisina ng mga politiko, regardless if they are lawmakers, governors, or what have you. Hindi na po ba i-honor ng kahit anong hospital? Magkakaroon po ba ng directive clearly na hindi na mag-honor ng guarantee letters from any politicians?
Talaga to kung magtanong loaded. You know, constituents are free to ask assistance from their elected officials. But do they need a guarantee letter from them to get assistance? No. They can go straight to the Department of Health, and we will help them if they need help. And if we have the funds, we will provide the funds if they are qualified to get the funds.
Sir, if that's their option to get guarantee letters, will the DOH still honor those letters?
The law actually prohibits a guarantee letter. It
Yung law
basically
distribution lang, hindi yung mismong letter. It's vague on the giving, on the handing out of GLs.
So I talked to Senate President regarding this. Of course, if you write me a letter and you want someone, the DOH, to help your constituent, we will help them. Hindi siya GL. That's a request. That's a request.
Sir, so may discretion pa rin yung mga politiko.
Hindi. What discretion? What will happen to the discretion? It's very clear in the batas. So very clear yung batas, and we will follow the law. As an executive branch of the government, we will follow what the legislators put.
Hi, Secretary Ted, Hannah of SMNI. Just idadagdag ko lang po kay Kat. Yung mga mahihirap po, example, may 1 million po silang billing sa isang government hospital. Sasabihin nila, hindi nila kaya yung 1 million. Pupunta sila sa ganitong congressman. Si congressman, si party list, bibigyan ng ganito. Guarantee letter, 100,000 lang. So may 900 pa siya. Pupunta siya kay senator. And then magbibigay si senator ng another 100. Hanggang sa mabuo nila yung 1 million nila, sir. So kung sinasabi ninyong hindi na allowed ngayon sa batas natin,
No. The senator can guarantee, but sila magbayad nun. It cannot come from the GAA. Pag nag-guarantee siya maghahanap ng pera nun. No, but anyone can guarantee. I can guarantee to pay for you, but the one who writes the guarantee pays for it.
yun lang po gusto namin linawin, sir. Kasi nakikinig yung taong bayan.
Ganito, so sa taong bayan, zero balance billing na po ang inutos ng presidente. Bayad na ang bill nyo. Kahit 2 million, 2.7 million yung malaking bill na binayaran ng DOH para sa pasyente. Zero balance. Magpa-admit kayo sa basic accommodation at zero balance po. Hindi kayo withhold ng treatment. Treatment will be given to you.
Secretary,
So, zero balance billing na tayo since July of 2025. So number 1 yon. Kung ikaw ay nagpunta sa private hospital, talagang may babayaran ka. Kasi nag-private ka eh. You have to pay for the doctor, the room, the medicines, because you went to a private hospital. But for the DOH hospital, zero balance. Now, if you go to LGU, pwede namin tulungan ngayon through the medical assistance for indigent patients. So kailangan makipag-coordinate with the hospital director of the DOH or the regional director of the DOH.
one final question, Secretary. So you're saying po is hindi na kailangan ng mga Pilipino
Get
pumunta sa
assistance.
mga congressman and senators dahil kaya na ng DOH i-zero balance yung kanilang balance po sa hospital.
Sa Department of Health Hospitals, kayang i-zero balance sila.
Okay po, malinaw po.
So po nakatanungan, Eden Santos, Net 25.
Secretary, follow-up lang din po ako dun sa pinag-uusapan. GL po kasi, minsan nga ho, 10,000 lang, Secretary, binibigay po.
Let me just be clear, nagkaka-confusion tayo dito kasi you're all fixated on this guarantee letter. The DOH does not operate on guarantee letters. That is not our guarantee letter. So do not ask me about those guarantee letters. Ask the people that issue them. Kasi hindi naman po kami nag-i-issue ng guarantee letter.
Pero po yung mga ospital, pwede nilang tanggapin yung mga guarantee letters from the congressmen, senators. Pwede pa rin po yun. Yeah.
Sa private
Through
hospital,
GL.
this is private hospital?
Either private or government hospital po. Gumagamit sila ng GL.
That's their decision. Wala ako yatang role. If they want to accept a guarantee letter from a politician, that's up to them.
Ayun, yun po, malinaw po. At least,
But the
tuloy-tuloy pa rin naman
disbursement of
pala
the
po yung
funds-
GL, paggamit ng GL, ano po. Anyway, alam ko po doon sa basic accommodation, Secretary, ito po yung mga government hospital, tama po ba?
DOH hospital,
Oh, yeah,
so for
DOH
zero
hospital.
balance billing,
Yes.
basic or ward accommodation. Ito yung shared accommodation.
Apo, sa zero balance billing po
Yes.
ito. Ano pong iba pang programa ng DOH na maaari pong makatulong naman doon sa mga kababayan natin na yung kanila pong sakit ay hindi naman po pwedeng i-treat under the basic accommodation. So kailangan din po talaga nila doon sa private hospital dahil yung sakit po nila ay hindi po matitreat doon sa mga ospital.
May I know what condition that is?
Like cancer,
We treat cancer in government hospitals.
gaya po ng PGH.
Gaya ng DOH hospitals.
PGH is DOH hospital.
No, it's not a
No?
DOH hospital. It's a University of the Philippines hospital.
So hindi na po siya yung parang government hospital like before.
It's a government hospital, but it's a university-based hospital. It's not under the Department of Health. It was never under the Department of Health.
Okay. Ano-ano po yung mga ospital na
Madami
pwedeng
tayong misconception, ano?
ng
Madami
ating
tayong
mga kababayan?
misconception.
Kasi po, akala lang PGH ay under din ng DOH. and
Hindi
it's a
po
government
under,
hospital.
so that's the job of the media to tell people that the Philippine General Hospital is called UPPGH, University of the Philippines, Philippine General Hospital. It is under the budget of the Commission on Higher Education. Hindi siya budget ng Department of Health.
So ano-ano po yung mga ospital na ito para po yung mga kababayan natin, alam na nila kung saan po sila pupunta para sa zero balance billing.
Ang matagal na po nating inanunsyo, nasa website po ng Department of Health, ang listahan ng DOH hospitals sa lahat ng region ng Pilipinas.
Dito po sa Metro Manila na lang po.
We
para
have
yung-
22 in Metro Manila. Do you want me to enumerate them?
Pwede naman po para mas...
I'll just send you the list of
Okay,
the
sige
22.
po.
Okay.
Sa PhilHealth po, yun pong 60 billion pesos na isosoli po sa inyo sa ilalim po ng 2026 General Appropriations Act ay naisoli na po ba or kailan po ito maisosoli?
So, bago pa po na isama doon sa ating budget yung 60 billion, naglabas na po ng direktiba ang ating Pangulo na ibalik nung September. So, yun naman po ay pinakinggan ng ating mga mambabatas at sinama na nga po doon sa ating GAB before po na enact as GAA. So, na-aprubahan lang po nung nakaraang pong Lunes, kaya maghihintay po ngayon kami sa sangguni sa Department of Budget kung kailan po marirelease. Pero nakasaad na po doon, nakasama po yung 60 billion na yan.
Pero po nung kuhanin iyon ng government at ilipat sa National Treasury, cash po ba yon na kinuha sa PhilHealth at dinala sa National Treasury? Yung pong 89 billion and then yung 60 na tira na lang po yon.
Although nangyari po yung transaction before po ako nahirang na maging presidente po. Pero ang alam ko po, electronic transfer lang po. But cash basis po yon. Kasi pagka na-transfer po at automatic po, debited or credited na po yun doon sa accounts ng treasury.
Let me clarify. Mali yung sinabi mo. 89.9 yung pinarevert to the National